Hi, my name is Dan Chaskin. I'm a podiatrist, and I would like to share this PowerPoint presentation with you. I went to Memorial Sloan Kettering and I learned a lot at a seminar, and I want to encourage everybody else to go to Memorial Sloan Kettering's seminar on dermoscopy. Podiatric dermoscopy is what I am going to discuss today. My name is Daniel Chaskin, and before I begin, I'd like to give a disclosure. I am passionate about dermoscopy, and one goal I have is to encourage every one of you out there, every practicing podiatrist, to use dermoscopy. The benefit is that you have more useful information unseen with the naked eye to decide whether to biopsy or to monitor a lesion or to leave the lesion alone. Here you go. What is dermoscopy? Dermoscopy is performed using instrumentation that is capable of viewing structures and patterns beneath the skin. The diagnostic tool used is called a dermoscope. There is a distinct difference between a highly magnified clinical image and a true dermoscopic image that defines structures and patterns. For example, my previous two dermoscopes, I was unable to see structures and patterns. One problem I had was that there was not enough polarization present, so I could not see deep into the skin, especially collagen and vessels that were present. High polarization is the single most important feature I look for in a dermoscope. This is even more important than looking for any sort of pigment boost. However, a pigment boost is helpful, and this will be discussed later on in this lecture. A wide viewing field, an infection control cap, as well as having the ability to attach to a cell phone so that you can take pictures. Sometimes if you have a dermoscope that has high enough polarization, you could actually detect vasculature indicative of an amelanonic melanoma. Certain vessels have certain patterns that may indicate that. Even with a fine dermoscope, beware of not taking a biopsy. Even though certain vascular patterns such as comma-shaped vessels may be less worrisome than glomerular vessels or any other type of corkscrew vessels, please biopsy if there's any doubt or question in your mind. If you do not have a dermoscope, please refer to a podiatrist or someone else that has a dermoscope that's licensed in your state. The advantages of having a dermoscope is that you could send a dermoscopic image to a pathologist. This pathologist then has additional horizontal information in addition to the vertical information that they get from a biopsy that's taken. The lab also uses such information in sectioning the specimen. This way, the lab does not miss any additional information such as pseudopods, radio streaming. This horizontal information is critical in giving additional information to the pathologist so as to make a more definite, more informed diagnosis. The lab can even attach a copy of the pathology report to the dermoscopic image that's taken, and you could have both of them. This you could have to improve your diagnosis, and you could actually show this image to the patient or any other podiatrist that you feel are treating the patient. What is a non-polarized mode and what is a polarized mode? What a non-polarized mode is you have the superficial structures show up better when you use non-polarized dermoscopy, but beware that you have to remember to use a contact medium. This contact medium allows to limit the surface glare from the surface so that only the valuable information of the underlying superficial structures such as miliacysts, orthokeratotic keratosis, bluish-like area, will show up best on non-polarized dermoscopy. But remember, this contact medium, a liquid gel, must be used. Especially when you deal with nails, you must always maintain contact with some sort of a gel that will not slide off the toenail plate itself. This is how the polarized mode looks. This over here, I'm pointing to an infection control cap that can go over a dermatoscope. This here is a reedy ridge. Let's focus and magnify this reedy ridge right here. Now this is a ridge that's affiliated with a ridge. Now this is a reedy ridge that's affiliated with a furrow.